So this is simple. Am I at higher risk? Are asthmatics in general at higher risk for contracting the illness? There was a couple of studies that have been published, and there's a couple of there's some information that's come out of China. When you look at patients who have been hospitalized for COVID-19, there did not appear to be an increased percentage of them having asthma when you compare it to the general population. So the simple answer to this is that if you have asthma, you're not really at increased risk of developing the infection. Now we'll talk about, are you at increased risk of having complications? But the important thing is that in general, it's not believed that if you have asthma, you're at increased risk of contracting the illness. Am I at higher risk for having complications? Am I at higher risk if I get COVID-19 infection and I have asthma? Am I at higher risk? And this is very interesting. The CDC has put asthma in the category of higher risk populations for having complications should they get COVID-19 infection. But I want to point out why. COVID-19 is a respiratory illness. It affects mainly the respiratory tract. It's transmitted via the respiratory tract. It's a coronavirus, and other coronaviruses, which I'm sure you all have heard of, MERS and SARS, other coronaviruses have been proven to increase asthma exacerbations if you get those infections. Most experts that I've talked to, and again, the CDC has put it on their website as far as high risk for having complications. In general, most experts feel that if you have asthma, you are clearly at higher risk for having an asthma exacerbation if you get the COVID infection. But there's really no data to confirm this. But again, it's on the CDC list of risk factors for having more severe disease and complications. And the data right now doesn't show that, but again, we are treating that as a high risk for complications if you have asthma